Hello, my name is Dr. Diwan S. Raja. Today I will discuss a few multiple choice questions in antiarrhythmic drugs. Question number 1. Which of the following is a class 2 antiarrhythmic drug? Procainamide, metoprolol, amiodarone, diltiazem, adenosine. Answer should be B. Metoprolol. Question number 2. A 62-year-old woman with known history of bronchial asthma developed tachyarrhythmia following a myocardial infarction. Which of the following antiarrhythmic drug will be most appropriate for this patient? Propranolol, amiodarone, metoprolol, disopyramide, quinidine. What would be the answer? C. Metoprolol, not propranolol. She has history of asthma, there is history of bronchospasm, so we need selective beta blocker. The answer should be metoprolol. Question number 3. Which of the following antiarrhythmic drug is a local anesthetic? Shorten phase 3 repolarization, decreases the duration of the action potential, suppress arrhythmia by abnormal automaticity, and abolishes ventricular reentry. So what is the choice? Mexiletine, tokenamide, flecainide, lidocaine, digoxin. Answer should be number 3, D, lidocaine. That is the local anesthetic with all these properties. Question number 4. Which of the following drugs has anticholinergic adverse effect like dry mouth, urinary retention, blurred vision, and constipation? And it is contraindicated with heart failure. Answer should be A, that is the disopyramide. Number 4, answer is A, disopyramide. Not ismonol, not sotalol, not verapamil, not magnesium. This is the drug that has adverse effect like this, anticholinergic adverse effect. Number 5. Which of the following antiarrhythmic drug is a calcium channel blocker and shorten action potential? Amiodarone, dofetilide, sotalol, ismolol, verapamil. Answer should be verapamil. E. Okay. Question number 6. Which of the following group of antiarrhythmic drug prolongs phase 3 repolarization? What is the answer? Drug prolongs phase 3 depolarization. Choice 1A, 1B, 1C, 2, 3. Answer should be E, 3. This is so the class 3 antiarrhythmic drug prolongs phase 3 repolarization. Prolongs phase 3 repolarization. This is the class 3 antiarrhythmic drug. Question number 7. What is the effect of B-Adrenoreceptor blocker, that is the class 2 antiarrhythmic drug, on the action potential? Okay. Slows phase 0 depolarization, shorten phase 3 repolarization, suppresses phase 4 depolarization, prolong phase 3 repolarization. So what is the answer? Suppresses phase 4 depolarization. Answer is C. These class 2 beta blockers, what they do, they suppress phase 4 depolarization. C is the answer. Okay, we got number 7, Number 8. A 63-year-old woman is being treated with an antiarrhythmic drug to maintain sinus rhythm after direct current cardioversion of atrial flutter developed synchonism. Blurred vision. The manifestation of synchonisms are blurred vision, tinnitus, buzzing sound in the ear, headache, disorientation, psychosis. Large doses of which of the following drugs display these adverse effects? Question number 8. Procainamide, quinidine, ismolol, amiodarone, diltiazem. What is the drug that causes, that have adverse effect like synchonism? Okay, answer should be quinidine. Quinidine. Okay, so this drug is derived from the cinchona plant. Also, this may cause same type of manifestation in quinine that is used in antimalarial drug, and here it is the quinidine, another this drug. This is for the this is an antiarrhythmic drug used to manage the arrhythmia, and this causes this synchonism. Okay. Question number 9. A 65-year-old woman is being treated for supraventricular tachycardia for last 2 months and has developed bradycardia, cold intolerance, somnolence, anorexia, fatigue, and weight gain. Her laboratory test result indicates low triiodothyronine, thyroxine, high thyroid stimulating hormone level. Which of the following antiarrhythmic drug is likely to cause these signs and symptoms? Quinidine, propranolol, amiodarone, digoxin, sotalol. So what is the choice? Right choice. Question number 9. Answer should be amiodarone. Amiodarone may cause hypothyroidism. In certain situations, in some cases, it may also cause hyperthyroidism. In hypothyroidism, there is T3, low T4, high TSS level. So this is hypothyroid patient's feature. This is an adverse effect of this drug, amiodarone. Okay, so we got number 9, that is the amiodarone. Let's go number 10. Which of the following antiarrhythmic drugs is a very short-acting beta blocker used for intravenous administration in acute arrhythmias that occur during surgery or emergency situation? These are the choices: propranolol, metoprolol, sotalol, ismolol, atenolol. So that is having a very short-acting, provided it is given by intravenous administration. So what is the drug? Drug should be D, the ismolol. Number 10, D. Okay, we got the answer is D. Now go number 11. Which of the following drug is a class 3 antiarrhythmic agent, has potent beta blocker activity, blocks a rapid outward potassium current, and lengthens the effective refractory period? Choices are amiodarone, sotalol, dophytilide, propafenone, adenosine. Question number 11. So answer should be B, the sotalol. Sotalol is the answer. Okay. Then we'll go question number 12. Which of the following antiarrhythmic drug has an extremely short duration of action, approximately 15 seconds, and is a naturally occurring nucleoside used intravenously to abolish supraventricular tachycardia? Choices: digoxin, adenosine, amiodarone, propranolol, and disopyramide. Answer should be B. Okay, that is adenosine. Short duration of action, only 15 seconds. There is a short duration of action. Okay, given intravenously and used to manage supraventricular tachycardia. Answer is adenosine. Okay, so you got the adenosine here. Number 12. Number 13. What is the common mechanism of action of class 1, class 1A, B, C antiarrhythmic drugs? Potassium channel blocking, calcium channel blocking, sodium channel blocking, beta-adrenoreceptor blocking. Answer should be C. 13C, sodium channel blocking. Okay. Number 14. At toxic concentrations, digoxin causes ectopic ventricular beats that may result in ventricular tachycardia and fibrillation. This arrhythmia is usually treated with what? Verapamil, diltiazem, sotalol, lidocaine, amiodarone. Presents. Answer should be lidocaine. May be used by phenytoin also, but our choice here is the lidocaine. Number 14. Answer is D for dog. D, lidocaine. Okay, we got that. Number 15. Which of the following is a class 1A antiarrhythmic drug with chronic use that causes high incidence of side effects including reversible lupus erythematosus-like syndrome that develops in 25 to 30% of patients. So there is the adverse effect in around 25 to 30% of patients. And what is that drug? Procainamide, disopyramide, lidocaine, mexiletine, procainide. Answer should be what? Procainamide. A. 15. Answer is A. Okay. Number 16. Which of the following is the first line antiarrhythmic for patient with acute ventricular tachycardia? Acute ventricular tachycardia may be converted into atrial into ventricular fibrillation that is certainly life-threatening condition, and management by what drug? Lidocaine, verapamil, sotalol, digoxin, propranolol. What is the choice for acute ventricular tachycardia? Answer should be lidocaine. And our emergency room physician, emergency department staff are well versed about the application of lidocaine to manage acute ventricular tachycardia, okay, by lidocaine. So answer is A. Number 16. Answer is A. Number 17. Torsade de Pointes. That is what? That is polymorphic ventricular tachycardia. May be an adverse effect of which of the following antiarrhythmic drug? Propranolol, metoprolol, ismolol, diltiazem, procainamide. What is the answer? Number 17. Torsade de Pointes is an adverse effect. Torsade de Pointes is the polymorphic ventricular tachycardia. Answer should be adverse effect of what? Procainamide. It may be the adverse effect of some antidepressant drugs that also cause torsade de Pointes. Our choice here is procainamide. Okay, that is polymorphic ventricular tachycardia. Number 18. Which of the following antiarrhythmic drug has proven efficacy to treat torsade de Pointes? There is polymorphic ventricular tachycardia. What is the treatment? Choices are magnesium sulfate, digoxin, atropine, adenosine, procainamide. Answer should be what? What is the answer? Magnesium sulfate. Number 18. The right choice is the magnesium sulfate to manage torsade de Pointes. And it is given intravenously. Which of the following antiarrhythmic drug is indicated to control heart rate in supraventricular tachycardia or atrial fibrillation, especially with congestive heart failure? Choices are adenosine, digoxin, magnesium sulfate, diltiazem, ismolol. What is that? Answer should be digoxin. Number 19. Answer is B, digoxin. Okay, digoxin. Number 20. Which of the following is a common arrhythmia that involves multiple ectopic foci of atrial cells, creating the chaotic movement of the impulses through the atria? The ventricular response is rapid, 100 to 150 beats per minute, and the rate is irregular. So what is the arrhythmia? Okay, atrial flutter, atrial fibrillation, acute supraventricular tachycardia, acute ventricular tachycardia, AB nodal reentry. So irregular, multiple foci of atrial cell, okay, and chaotic movement. So answer should be B, atrial fibrillation. It will be guided by EKG. We may not get any P, distinct P. Atrial flutter, it will be different. We have one point that has re-entry repeatedly in the atria, and we'll get sawtooth appearance in EKG or ECG. Here we may not get P wave. In atrial fibrillation, there will be chaotic movement of impulses and multiple foci on atrial cell, and it is irregular ventricular response. And answer should be B, atrial fibrillation. Atrial fibrillation. Number 20. Okay. Number 21. Which of the following drugs have therapeutic application for atrial fibrillation except one? So, management of atrial fibrillation needs multiple drugs sometimes. One drug is not sufficient. Okay, so what are the drugs may be useful? We have multiple choices to initiate the treatment of antiarrhythmic. Multiple choices of the drug to treat the atrial fibrillation. So, which of them is not used to manage atrial fibrillation? Propranolol, amiodarone, anticoagulant therapy. That is also essential to prevent the embolism. Okay, lidocaine, dofetidine. Okay, so all the drugs are useful except lidocaine. Lidocaine usually does not work on the atria or supraventricular area. It works on the AV node and below, especially the ventricle. So D is the choice. All other may be applied to the atrial fibrillation. Maybe one, maybe multiple. Okay. Propranolol, amiodarone, anticoagulant therapy, it can be used with other drugs. Okay. But not the lidocaine. That will not be effective in the management of atrial fibrillation. Okay, we got 21. Number 22. All of the following drugs are used to control the cardiac rate of atrial flutter except one. The exception is what? Okay, propranolol, verapamil, digoxin, atrial flutter will get in EKG sawtooth appearance of the P waves, multiple. Okay, and we have a separate foci in the atria other than the SA node. Okay, and we get the sawtooth appearance, and we can use any drug, propranolol, verapamil, digoxin, lidocaine, which we should not use. Answer is the lidocaine. 22 answer is B. Lidocaine doesn't work on the atria supraventricular area. Okay, we got that. So answer is lidocaine. This is the exception, and that is the answer. Number 23. All of the following drugs slows conduction through the AV node are useful to treat supraventricular tachycardia with AV nodal reentry except one. The exception is what? Propranolol, verapamil, digoxin, epinephrine. So out of this should not be used. It may be used only in case of ventricular fibrillation, not supraventricular tachycardia with AV nodal reentry. So this is the exception. That is the answer to our question. All these may be useful in the management of supraventricular tachycardia with AV nodal reentry. Question number 24. Which of the following drugs are useful in the treatment of reentrant supraventricular tachycardia, atrial flutter, atrial fibrillation, hypertension, and angina? So multiple problem may be managed by a drug. A drug has multiple use, multiple efficacy in multiple conditions. So what is the drug? Digoxin, verapamil, lidocaine, imodron, quinidine. So reentrant supraventricular tachycardia, atrial flutter, atrial fibrillation, hypertension, angina. What is that drug? That should be the Verapamil. That is the medication. That is a calcium channel blocker, the Verapamil. Okay, so we got the Verapamil choice for the management of these problems. Okay, now we go to the next question, number 25. Which of the following drugs have actions similar to those of lidocaine? Can be administered orally or is used for chronic treatment of ventricular arrhythmias associated with previous myocardial infraction. Okay. So ventricular arrhythmias associated with previous myocardial infarction, what would be the choice? Procainamide, disopyramide, mexiletine, amiodarone, diltiazem. Answer should be mexiletine. Mexiletine is the choice. Okay, similar to lidocaine, can be administered orally. Okay, and this is the answer key. These are the answer keys. So that's all about the antiarrhythmic drug multiple choice question. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.